If you're over the age of 60 and your doctor has told you that your blood sugar is normal, that word normal is doing a lot of heavy lifting, and it may not mean what you think it means. So normal on a blood test is just a line that has been drawn to diagnose diabetes. It was never meant to tell you that your level is safe or that it is where you want it to be or that you can just carry on doing exactly what you have been doing. The risk that comes with blood sugar does not switch on the moment you cross into the diabetic range. It rises very steadily long before that, for years and years before that, creeping up the whole time. And after the age of 60, your body becomes more vulnerable to that. So in this video, I want to explain why normal is not the same as optimal. I want to walk through what the landmark trials actually show, and the real number that you should arguably be aiming for. And there is an important twist in this video, because the right target is very different depending on whether you take diabetes medications or not. And getting that wrong can be very, very dangerous. So stay with me until the end if that relates to you. And again, if you find this video useful, if you find it valuable, if it helps you in any way, then please, please, please help me out by liking the video, giving the video a hype as well, and subscribing to the channel. It won't cost you a penny. It is completely free, but it supports me to keep making these videos and keep making them free for you, to hopefully help as many people as possible. So thank you so, so much, and let's carry on with the rest of the video. So the first thing to understand here is that normal, in inverted commas, is just a threshold. It is not a target. When your blood sugar is measured, doctors usually order either a fasting glucose or, more commonly, an HbA1c, sometimes written as A1c, which is basically your average blood sugar over the last 3 months. The cutoffs that label you as normal, or pre-diabetic, or diabetic are useful to make a diagnosis. But the harm from glucose does not respect those lines. Nothing in medicine or physiology is truly black and white like that. The relationship is continuous, which means that as your average level creeps up, your risk creeps up with it as well, even while you are still sitting inside this so-called normal range. And there is good data behind this. A large study from the UK called the EPIC Norfolk trial followed tens of thousands of middle-aged and older people over many years and found a steady rise in deaths from all causes and from heart disease in particular as their HbA1c increased. And to put a number on it that you can actually hold in your head, every 1% rise in HbA1c was linked to roughly a 24% higher risk of dying from anything over the follow-up period. And that rise was already visible within the normal range, well below the diabetes line. So being told that you are normal is a bit reassuring, I guess, but it is not the same as being told that you are in the clear. And this matters most for your brain and for your heart. So in a study published in the New England Journal of Medicine, and as always, I will put all of the links in the description below for you, researchers followed more than 2,000 older people who did not have diabetes and tracked their glucose over the next few years. Now, even in these people, those with a higher average glucose had a higher risk of going on to develop dementia, and the difference showed up at levels most doctors would happily call normal. To put rough numbers on it, an average glucose of around 6.4 in the UK or 115 in the US was linked to a noticeably higher dementia risk than an average of around 5.5 or 100 in the US. In the study, people without diabetes who sat around the 115 mark had roughly an 18% higher chance of going on to develop dementia than people sitting closer to 100, and neither of those would earn you a diagnosis of diabetes. Now, as with a lot of this research, this was observational data. So it cannot prove that the glucose itself caused the dementia, but it lines up with everything that we understand about how higher than normal sugar slowly damages the small blood vessels in your brain, including the ones that feed the memory centers, and the ones that can gradually cause vascular dementia and accelerate the kind of cognitive decline nobody wants. And the thing is, as you get older, this becomes a lot more important, particularly over the age of 60. So as we get older, a few things happen all at once. Our muscles, which are the main place your body dumps glucose, gradually shrink and become a bit less responsive to insulin. They get infiltrated with a little bit of fat, they lose some of their quality, and the receptors that move sugar out of the blood and into the muscle stop working as smoothly. At the same time, the cells in the pancreas that produce insulin gradually lose some of their reserve, some of their ability to push out that extra insulin when you need it after a meal. The result is that a lot of people after the age of 60 drift slowly upwards into the high normal and then into the pre-diabetic range without ever feeling a single symptom. There is no warning sign, no shaking, no sweating, nothing. It just quietly creeps up. At the same time, older blood vessels and an older brain are simply more vulnerable to the damage that raised glucose causes through a process called glycation, where sugar literally sticks to proteins in the body to form what we call advanced glycation end products, or AGEs. Picture it like rust slowly forming on the inside of your arteries. And one of the worst hit proteins is collagen, which is what gives your artery walls their elasticity. So when sugar gums up that collagen, your arteries get stiffer, your blood pressure creeps up, and the small vessels feeding your eyes and your kidneys and your brain take a hit they did not deserve. So the same level that might be fairly harmless at the age of 30 can do more harm at the age of 65, because the tissue it is hitting is already older and a bit more fragile. Which is why I would not want anybody over the age of 60 to treat a normal label as a reason to relax, and certainly not as a green light to keep eating the same way they did in their 40s. Now, the obvious conclusion here might be that anybody over the age of 60 should be aiming to get their glucose level as low as possible. Now, that is true for some people, but for other people, it is outright dangerous. And this is the part that the headlines almost always get wrong, and the part that I really want you to hear. The single most important question is not what your number is, but how you are getting there. So lowering your blood sugar with food and movement is a completely different thing from forcing it down with strong medication, and the two have very different consequences. But to understand why, we need to talk about one of the most important and arguably most shocking diabetes trials ever run. So the trial here was called the ACCORD trial, and it changed how we think about this exact question. Researchers took more than 10,000 people with type 2 diabetes who were at pretty high risk of developing heart problems, with an average age in their early 60s, and they split them into two groups. One group aimed for a near normal HbA1c below 42 in the UK or 6% in the US, using whatever combination of medication it took, including insulin, sulfonylureas, and metformin stacked together. The other group aimed for a more relaxed target, between 53 and 63 in the UK, or 7 and 7.9% in the US. The expectation, based on everything we thought we knew, was that the group with the lower sugar would do better. Lower number, less damage, fewer heart attacks, everybody happy. But instead, the trial had to be stopped early because the intensively treated group had a 22% higher risk of dying, roughly 257 deaths in the intensive group versus 203 in the standard group, despite the intensive group sitting at much better looking numbers on paper. So how on earth does a lower, healthier looking blood sugar lead to more deaths? Basically, driving down these numbers really hard with drugs, often several drugs at once, caused several episodes of hypoglycemia, which is the medical word for blood sugar crashing too low. And in older people whose warning signs are often blunted and who may already be on blood pressure tablets and blood thinners, those episodes can trigger falls and heart rhythm problems, and even worse as well, bleeding on the brain because they have fallen over and hit their head on the floor. Some people also lost the early warning signs of a low entirely, a condition called hypoglycemia unawareness. So their sugar would tank and they would not even feel it coming until they were already in trouble. So the level on the page looked healthier, but the journey to get there was actively dangerous. This is why modern guidelines deliberately set easier targets for older people on medication, often somewhere between 53 and 69 in the UK, or 7 and 8.5% in the US, depending on their overall health and how independently they live, and why doctors increasingly try to take people off the riskiest drugs, particularly sulfonylureas and insulin, rather than just piling more on. Basically, what I am trying to say here is that if you take insulin or you take tablets like sulfonylureas, lower is not the goal. Chasing a perfect number on your own can put you in hospital. And if this is the case for you, then you have got to listen to your own doctor about which number to be aiming for. Not listening to me here, because obviously I do not know your record, I do not know your medication history, I do not know anything about you, so please just listen to your doctor if you take those medications. So this is the part where it all gets a bit confusing. So on the one hand, I am telling you that people with higher blood sugar tend to die earlier, but then on the other hand, the group in the ACCORD trial that achieved lower blood sugar died more often. Well, the answer here is that a low number reached naturally is not the same as a low number forced down with medication artificially. When your blood sugar is low because you eat well, and you move your body, and you carry less fat around your middle, and your own pancreas is producing just the right amount of insulin at just the right time, that is a sign of a healthy, well-functioning system. When it is low because 3 different drugs are dragging it down past where your body actually wants to sit, the benefit of the low number gets canceled out and then some by the risk of crashing too far. Basically, the level on the page looks the same. It is roughly identical, but what it represents could not be more different. One is a person whose biology is working with them. The other is a person whose biology is being overridden. So, for the large group of people that do not take diabetes medications, the encouraging thing here is that the levers that lower your blood sugar safely are entirely in your own hands. The biggest lever is what is on your plate. The aim is to get most of your carbohydrates from whole intact foods like vegetables and beans and lentils and oats and barley, which come wrapped in fiber and water and structure, so they are absorbed really slowly. And then at the same time to try and massively cut back on the refined carbohydrates that come in ultra-processed foods that usually spike your blood sugar within minutes of the first bite. And this is not about carbs being the enemy. It is about the form the carb arrives in. A bowl of lentils and a slice of white bread can technically contain a similar amount of carbohydrate, but the lentils release their sugar so slowly that your blood glucose barely moves, while the bread sends it shooting up like a rocket. That difference is everything, particularly over the age of 60, because your pancreas simply does not have the spare capacity it had at 30 to mop up those big spikes over and over again. The second lever, and honestly the most underrated one, is your muscle, because your muscles are the main place that spare glucose gets stored and then burned off. Think of your skeletal muscle as the body's biggest sponge for blood sugar. At rest, it is responsible for something like 80 to 90% of all the glucose your body takes out of circulation, and after a meal, that figure climbs even higher. The way it does this is through little transporter proteins on the muscle cell surface called GLUT4, which only swing into action when the muscle contracts. Which is exactly why a short walk after meals blunts the rise in your blood sugar so powerfully, and why regular resistance training, even just a couple of short sessions a week with light weights or bands, builds up the muscle that soaks it all up in the first place. And over the age of 60, this matters twice as much, because we lose muscle at roughly 3 to 8% per decade after the age of 30, and that loss accelerates after 60. So every kilogram of muscle you preserve, or build back, is a kilogram of tissue that is actively pulling sugar out of your blood without you having to think about it. This is why I talk about muscle so much on this channel, because for blood sugar specifically, it is not a nice to have, it is the main thing. The next lever is sleep, which I think a lot of people over 60 genuinely underestimate. Even 2 or 3 nights of poor sleep, the kind where you are waking up multiple times or sleeping fewer than 6 hours, has been shown in controlled studies to drop your insulin sensitivity by somewhere around 20 to 25%. Your cells basically behave as if you have just eaten a very large meal, even when you have not. So fixing sleep, not by lying in bed for longer, but by protecting the quality of what you do get, going to bed at the same time, cutting the late caffeine, getting morning light on your face, is one of the fastest improvements you can make to your blood sugar, and it costs you nothing. And lastly, losing a little weight from around the middle improves this entire picture, even modest amounts, because the visceral fat packed deep inside your abdomen is itself an actively inflammatory tissue that pushes your liver and your pancreas in the wrong direction. Take off even 3 to 5% of your body weight and your numbers start to shift. None of those things there carries any risk of your blood sugar going too low unless you massively restrict your calories, which you know the average person is not going to be doing. And this is why this is the right approach for anybody wanting to lower their blood sugar number, to try and do it naturally, through what they eat, through how they move, through how they sleep, and through protecting the muscle they still have. So the real answer here is that there is not really a magic line where blood sugar suddenly becomes safe. The risk runs very much on a sliding scale, all the way down, and for almost everybody, like with blood pressure, the lower your blood sugar sits, as long as it is your own body keeping it there rather than medication, the better. So if you are not on any diabetes medication, then do not settle for simply scraping under the diabetic line. You want to try and keep your fasting glucose in the low 5s, ideally under around 5.5 in the UK or under around 100 in the US, and your HbA1c comfortably below the pre-diabetic range, which means under about 39 to 42 in the UK, or 5.7 to 6% in the US. And like I said, generally for most people, the lower the better. The closer you can get towards the lower end through food and through movement, the more protected you are against all of these diseases that I talk about all the time on this channel. So treat those numbers as the level rather than the finish line, if that makes sense. The job is not to hit a target once, it is to keep sitting in that zone year after year. And if you are on any diabetes medication, then your real number is the one that your doctor has set for you. and it is deliberately higher to keep you safe from going too low. For you people, the message is very much the opposite, which is to work with your team, never to chase a lower number on your own, and to flag any episodes where you feel shaky or sweaty or confused or suddenly very tired or unusually irritable, because those are signs that your treatment may be pushing you down too far and your doctor needs to know about it sooner rather than later. And the ultimate goal for anybody who takes type 2 diabetes medications is to do the lifestyle things alongside all of that, very gradually, so that eventually, with lots of monitoring and lots of guidance, you may be able to reduce your medication or possibly come off them entirely under supervision. That is the best outcome, but it is a slow road and it requires your doctor in the loop the whole way. And again, as with every video, this is education, it is not personal medical advice. And if you are confused, or you have any questions, or you are about to change anything based on what I have said, then please make sure you speak with your own doctor as well, who knows you and who knows your medication record. This is Dr. Olivia Brooks, and I really hope you found this useful. I hope it sort of sparked some new questions in your own head as well, and got you motivated to make some changes, however small they might be to start with. Thank you so much for watching, and I will see you in the next one.